unmute. They unmute it. You just press something on the unmute. Don't unmute it. They don't want to hear you. Just want them alone. They want the direct, because the sound you need to get out. Brethren, we are going to stand as we sing hymn 469. What a fellowship, what a joy divine, leaning on the everlasting arm. What a blessedness, what a peace is mine, leaning on the everlasting arm. What a fellowship, what a joy divine, leaning on the everlasting arms. What a blessedness, what a peace is mine, leaning on the everlasting arm. Leaning, leaning, safe and secure from all alarm. Leaning, leaning, leaning on the everlasting arms. Oh, how sweet to walk in this pilgrim way, leaning on the everlasting arms. Oh, how bright the path grows from day to day, leaning on the everlasting arms. Leaning, leaning, safe and secure from all alarm. Leaning, leaning, leaning on the everlasting. What have I to dread? What have I to fear? Leaning on the everlasting arms. I have blessed peace with my Lord so near, leaning on the everlasting arms. Leaning, leaning, safe and secure from all alarms. I am leaning, leaning, leaning on the everlasting arms.
Let us pray. Father in heaven, again, we want to give you thanks for your blessing thus far. Thanks, dear Lord, for your leading. And as we are about now to go into our program, we pray, Lord, that you will guide us through. Those on Zoom, Lord, we pray that they listen attentively. And our presenter, we pray for a blessing upon her. In your name I pray. Amen. This evening, we have with us Yolanda Bryce. She's a breast imagery and interventional radiologist at Memorial Solon Kettering Cancer Center. She works to diagnose breast cancer and treats breast cancer with minimally invasive and innovative procedures. Working with medical oncologists, radiation, and surgeon to provide patients with better outcome. I now present to you Yolanda Bryce.
Hello, how are you? I hope you can hear me well. I wanted to share my PowerPoint, and I believe first the host has to enable my screen sharing. Happy Sabbath, everyone. It's so nice to be remotely with you. I wish I could be in person with you in Jamaica. If the host could please allow me to share my screen. I have a PowerPoint. Thank you, perfect. Thank you so much. One moment. Great. Okay, thank you. Everybody can see this, I hope. Dr. Sinclair, I see you're on. Can you tell me if you can see my screen? You can say you're muted, so thumbs up. I can just thumbs up if you can.
Yes, I can see your screen.
All right, great. Thank you so much. So my name is Yolanda Bryce. I'm a doctor at Memorial Sloan Kettering Cancer Center in New York. It specializes in cancer. And today I'm going to talk about breast cancer screening. I'll talk a little bit about breast cancer. I'll talk about breast cancer screening. And this, since it is October, which is Breast Cancer Awareness Month, and we have the fabulous Yvonne Dunkley, who is a breast cancer survivor, and she has shared with you her ministry. And so that's what we're going to talk about. It's a short presentation, so bear with me. And okay, so we have a few numbers to talk about, and the numbers reflect why this topic is very important. So breast cancer is the #2 cause of cancer death in women in the US, and 1 in 8 women will have breast cancer. If we talk about Jamaica specifically, Jamaica has the #1 cause of cancer death in women in Jamaica. In the US, it's #2. In cancer in Jamaica, it's the #1 cause of cancer death. Jamaica has the highest incidence rate of breast cancer in Caribbean. So that means more women are getting breast cancer in Jamaica than other countries in the Caribbean. And in Jamaica, the breast cancer is more aggressive and presents at a later, more advanced stage than other countries that are considered developing countries. The death rate, unfortunately, is 40% higher in Black women compared to white women in the US. And this is also reflected in the Caribbean. There's increased rate of triple negative breast cancer, which is a very, very aggressive kind of breast cancer. So this kind of aggressive breast cancer is in Black women in the US and also in Jamaica. And there's there's increased rate of triple negative breast cancer in Jamaica women. 28 to 33% of breast cancers are triple negative breast cancers in Jamaica, which is 2 times the rate of other countries. So like double rate of this really aggressive breast cancer we can find in Jamaica. And there's some studies that are trying to see why Black women have this kind of mutations, these kind of genetic mutations that lead to this breast cancer, this type of breast cancer. And what they've seen is that it seems like the genetic mutation, it stems from Africa. So it's important to get screening with mammograms, and it is very important for Black women to get screening. Use of mammograms has shown decreased mortality, so patients live longer if they have their mammogram. Unfortunately, though, there's no population-based screening program in Jamaica, at least in my research and what I'm aware with. Women have to be informed and then go and they go and get their mammograms. The Jamaican Cancer Society recommends that women over the age of 40 have an annual mammogram, and they should continue as long as the person is well. The question often arises, is mammogram alone enough? A lot of women have what we call dense breasts. If we look at this group of breasts here, there are 4 breasts here, and these are 4 mammograms. We have a fatty breast here on the extreme left side, and this breast, you'll notice that it's very gray. This gray tissue is fatty tissue, and you don't see a lot of this white tissue. White tissue is the fibrin glandular tissue, which is like what could produce milk in a lactating woman. So this is a fatty breast, and so cancer presents as white. So you can see that if a white cancer presents in this gray background, it's easy to pick up. This patient has mostly gray, but does have this patch of white tissue. So this is still considered not dense. Then you have these patients that have a lot of this white tissue, and this white tissue can hide cancer sometimes. So if you look at this patient here, right, with a very gray breast, here the white small cancer is easy to find. But what if there's like all this white and then you see the cancer here? What if this one was like right here? It would be hard to see. So sometimes it's necessary to add ultrasound in order to see the cancer. Mammogram is still very important because even in dense breasts, mammogram picks up the early cancer, which looks like just calcifications, and ultrasound cannot pick up those calcifications. So you can never get rid of the mammogram. I know a lot of women are not a fan. You can't get rid of a mammogram. So you have to do the mammogram and ultrasound because they pick up different things. There are some studies that show that different aspects of our lifestyle can be associated with breast cancer. It's hard to determine that these are the things that cause breast cancer, but there are some factors that are associated with an increased risk of breast cancer. There's alcohol consumption, being overweight or obese, sedentary lifestyle, meaning you don't move too much, you don't exercise a lot, not giving birth before age 30, not breastfeeding, use of birth control, it normalizes after about 10 years of use of birth control, and hormonal therapy after menopause. A lot of patients ask me, why do some people that have a bad lifestyle not get cancer, while other people that do have a great lifestyle get breast cancer? So my mom has this saying that she says, Jaka said this world no level. So it means that some patients will have great lifestyles and unfortunately they will end up with breast cancer. And then some people have bad lifestyles and end up with breast cancer. So I made this little table here to demonstrate it, right? So if this is all people, right? All people in the world, and we're trying to see what percentage of them will get breast cancer. The patients with a bad lifestyle will have a higher percentage or a higher chance of getting breast cancer than patients with a good lifestyle. But you'll still see that no matter what, there are still a group of people with good lifestyle that will end up with breast cancer. So it is important to still get your mammogram and ultrasound, or just mammogram alone, depending on what your doctor recommends, even if you have a good lifestyle. Now, this is a chart that I use to demonstrate why should we get mammograms. Some people say, well, if I'm going to die of breast cancer, I'm going to die. You don't have to die of breast cancer. The whole point is trying to pick it up early. So if you have breast cancer that is just in the breast alone, we call that local. 99% chance that you're going to live and die of something else if you pick up the cancer when it's only in the breast. And you know what picks up cancer when it is only in the breast and you can't feel it and nobody can feel it? It's a mammogram. That's when if local stage breast cancer is picked up. And if it's picked up then, because you're going for your mammograms, if it's picked up then, you have a 99% chance of living and dying of something else. If this breast cancer has spread to lymph nodes, we call that regional disease. If it has spread to lymph nodes, so it's just in the breast, it has spread to the lymph nodes, you have an 85% chance of dying of something else. You're gonna outlive the breast cancer. And this is kind of a ballpark number because there's different stages of the regional disease, but it's about 85%. And if it goes and it spreads to some other parts of the body, we call that stage 4. If it goes to like the liver or the bone, then the patient may live about 27, it has a 27% chance of living and dying of something else other than breast cancer. Thankfully, these numbers are also getting better and better and better because of development of new things, so that even this stage 4 part still a lot of patients are living a long time. So I just want to say that again. So there are a lot of new treatments that are being used, and a lot of patients, even in stage 4 disease, they end up living with breast cancer. Like some patients live with diabetes. They don't necessarily have to die for it because there's a lot of new things going on. Just a little talk about some myths about mammogram, okay? The pressure of a mammogram is too painful or may burst the cancer. This is false. If you do have pain with a mammogram, sometimes taking something like Aleve, Advil, ibuprofen before the mammogram may help. It cannot burst the cancer. Some people ask that if they have a breast biopsy, this may spread the cancer, and this is also not true. There have been many studies to show if this is the case, and what they saw is that there's a biopsy and the cells are dislodged. Those cells are not connected to a blood supply, so they die. So very, very, very rarely that happens, and it's extremely, extremely rare. Okay, and so the next one is radiation from mammogram can cause cancer. So this, again, it's false, but a lot of radiation can cause cancer, and that's why, unfortunately, the technique of the mammogram is so uncomfortable, where they press down the breast because they're making it so thin and holding the woman so still that they're able to use such a very low dose of radiation. There's a reason why the mammogram is so uncomfortable, and that is to reduce the dose of radiation. I just want to say a tiny word about cervical cancer, if you can spare me one more minute. Cervical cancer is the second leading cause of cancer-related deaths in the world in women and in Jamaica. Every year, 392 women in Jamaica are diagnosed, and 185 women die of cervical cancer. It is typically caused by the HPV virus. And a lot of people think about it as, oh, if I don't have sex outside of marriage, if I don't have sex with multiple people, I won't get this virus. It is not true, okay? You can get it from your husband. You can get it because men are the carriers of this virus, and the men are not tested for the virus, and so they do not know they have the virus, and so they can spread it to their wives, or even if a girl has sex, and whatever the circumstances, that they can get the virus. So get the vaccine. The vaccine is available in Jamaica. Please get the HPV vaccine to prevent cervical cancer. It's a very easy easy fix. Okay, so cervical cancer, get your annual pap smear, colon cancer, fecal occult ball test, and colonoscopy at age 45. Prostate cancer, prostate exam, and PSA, which is a lab result, you should start at age 40. That's what I have. Thank you.
I'm not sure what's supposed to happen now. If I'm supposed to just go ahead, Dr. Bryce, or wait to be, oh, here comes someone. That we can't hear.
Any question?
I thought questions were going to be at the end.
Carlene, let them know the question is at the end for me, please.
After the next presenter, we'll have our question. So persons on the Zoom link, you can type in your question on the chat. This afternoon also, we have Dr. Carlene Sinclair, was born in Kingston, Jamaica. She was blessed to attend 3 Adventist colleges and universities: West Indies College, now Northern Caribbean University, Andrews University, and Loma Linda University School of Medicine. She's a board certified general surgeon. She practices in Claremont, Dave Point, and supporting areas. She is a general surgeon who specializes in the care of breast cancer patient and breast disease. She had the privilege of taking several mission trips to the Caribbean and South America. Recently, had a chance to go back to Jamaica on the Feed the Fight Cancer Program mission trip. She loves the Lord and enjoys caring for her patient. She is grateful that the Lord God has allowed her to give hope to so many. She and her daughter, Jonah, are blessed to be members of the Mount Olive SDA Church, where she serves in several departments. But just before Dr. Carlene Sinclair comes to set the pace, Sister Ferguson will sing. So the next voice is that of Dr. Carlene Sinclair. Thank you. I'd rather have Jesus than silver or gold. I'd rather be his than have riches untold. I'd rather have Jesus than anything this world affords today, than to be a king of a vast domain, or be held in sin's dread sway. I'd rather have Jesus than anything this world affords today. I'd rather have Jesus than man's applause. I'd rather be his than have riches untold. I'd rather have Jesus than houses or land. I'd rather be led by his nail-pierced hand than to be a king of a vast domain, or be held in sin's dread sway. I'd rather have Jesus than anything this world affords today.
Amen. Amen. I'd like to thank her for that wonderful presentation. That's a wonderful song. I love that song. Okay. Let me. My name is Dr. Carlene Sinclair. I know it went to share. I'm trying to take it off for a second so I can let you see me, but we'll just go right into it. You may have some duplication with Dr. Bryce's presentation. I'll try to avoid it as much as possible. And at the end, we'll both be available for to answer any questions. Okay. All right. Actually, I was trying to share my screen. I thought I was off the screen, but I'm still on the screen. As stated in the profile, my name is Dr. Carlene Sinclair. I practice in Florida. I'm a general surgeon. I have about a third to sometimes up to half of my practice is breast patients. Most of those are cancer. Some of those are other breast problems. We love to partner with Yvonne because it gives us an opportunity to help back home. I am also Jamaican, as you heard from my profile, and I'm always happy to do something that will help our people. I'm going to try to share my screen now. All right. So my topic is breast cancer fact or fiction. And as I stated, you will see some duplication in what Dr. Bryce said. I'll try to pass over those quickly. And at the end, will be both available for questions. And the reason I chose the topic fact versus fiction is because there is, when it comes to cancer, there's so much fiction out there. And over the past few years, especially for us in the United States, people have started coining terms like alternative facts, which is foolishness, or fake news, which is often real news that they don't want to believe. And I think it's important that we separate what's true from the lies. You know, the first lie got us all here: you shall not surely die. And trust me, if we believe some of the lies about breast cancer, you shall surely die. But there's hope. As Dr. Bryce said, the survival rate for cancer is breast cancer is very high. And if we do what we know will bless you guys, what we have been taught, if you allow us to take care of you, most people will live on to live out their lives and not die from breast cancer. It's the second most common cause of cancer in women in the United States. The reason it's higher in Jamaica is because the first cause of cancer in women in the United States is skin cancer. This cancer, of course, is more common in whites because even though blacks can get skin cancer, the rate is very low, and therefore it doesn't impact overall cancer numbers. But of course, in Jamaica, where we're all mostly darker skinned people, even though we have a wide range of hues, it is the number one cause. About 1 in 8 women will develop breast cancer by age 85. Breast cancer can and do occur in men. About 1% of all cancers are breast cancer in men. And some of you who are a little bit older may remember when Shaft was on TV back in the 70s, and the star Richard Roundtree, he is a breast cancer survivor. So it does happen in men, and I've taken care of a few over my lifetime of surgery. It is treatable with excellent results. I think this is the most important thing for you to remember. It is treatable with excellent results. So there's just under 300,000 cases per year, with about 43,600 deaths. These numbers are for the US, and I'm glad Dr. Bryce was able to give us the Caribbean numbers. And only about 17% of patients are gonna die. So that's the minority, 87%, and that's taking everybody, including the aggressive kind and the non-aggressive kind. There are two basic ways in which we look at risk factors. Some are unchangeable. There's nothing you can do about it. It is what it is. And then there are the risk factors that we actually can do something about. Here are the unchangeable risks. Gender. If you're born a woman, despite all the trends and all this that's going on, if you're born a woman, you are at risk for breast cancer. In fact, that's the number one risk for breast cancer. Number one risk is being born a woman. As we age, cancer is really a disease of the age, even though we know plenty of people, young people with breast cancer. So these two are, you know, there's nothing you can do about that. Even if you're one of those that they're in the minority, but there are people who are changing their gender. If you're a biological female, you're at high risk. Family history. This increases the risk to about 20% in general. Now, that's just general family history. If you are gene positive, and I only put the BRCA gene here because this is the most studied of all the genes. And we know that there's a high risk of development of breast cancer as well as ovarian cancer. There's several other genes that have been identified which shows increased risk as well. And there's some associated with other syndromes which include, in addition to breast, you have colon and stomach cancer, just as Lynn syndrome. But the gene positive people are at extremely high risk. The other population is only a 20% risk increase. So there are people who will come to me and say, they didn't get a mammogram because there's no one in my family. Well, most of the people with breast cancer are going to be the only person in their family with breast cancer. Only about 20% are going to have an increased risk. Breast density, and I'm just going to mention it because it's already here. But Dr. Bryce did an excellent job with the pictures and everything, talking about how breast density, and this is just an observation, because breast cancer has been studied in every aspect. And this is an observation, there's nothing you can do. You're born, some people have dense breasts. Most people, as they get older, the breasts become more fatty. If you remember her slide, the one on the left was mostly fatty, the one on the right was very dense. People who maintain that density as they get older, those are the ones that we notice are at risk. And that's one of the reasons we don't do mammograms earlier than age 40, because when we're young and we have the vibrant breast, those fibrous tissue are higher in the breast, and so the mammogram yield is lower. Okay, so here are the changeable risks. The changeable risks, meaning something that you and I can do something about. And we put here these things on this side are the ones that make the risk go up. These are the ones that make the risk go down. Obesity and high-fat diet. This is a risk factor for several other things, too, including colon cancer. And it's a risk factor for diabetes. And it's a risk factor for hypertension. So I know many people are worried about breast cancer, but you may know a few people with breast cancer. I can guarantee you know many people with diabetes and hypertension. So for us, we really should start looking at ways to mitigate this risk overall for our general health. Now, there is, of course, alcohol and tobacco. Tobacco is good for nothing. It's associated with almost every cancer. It's associated with heart disease, kidney disease, and everything else that kill people, including us. Menopausal hormonal therapy. Back in the late 70s, early 80s, they thought, okay, women have less chance of having heart problems when they're still menstruating. When they stop, then the risk is the same as men. Let's give them hormones. Well, what this did is increase the risk of breast cancer. It also increased the risk of heart disease. It didn't decrease it. So that's why we do not advocate hormonal therapy. Now, there are some people who do benefit from hormonal therapy, but it's very specific. But they were literally, once you hit menopause, you were being given pills for hormonal therapy. That is not done anymore because the benefits, the risks outweigh the benefits. Radiation treatment. This is not getting a simple X-ray or even a CAT scan, and it's certainly not getting a mammogram. Mammogram, as Dr. Bryce pointed out, has one of the lowest radiations of all. We're talking about people who have had some sort of a cancer where they've had to have radiation to their thyroid or to their chest. Usually this happens in young people because some of the Hodgkin's and non-Hodgkin's lymphoma, which is a special type of cancer, is treated with radiation. That doesn't mean you don't get that treatment, because there's only a small percentage who will develop breast cancer. And if they do, we treat them and they do just fine. It's usually a very early, very treatable slide. And I remember the slide, and I have a similar one to show you, but there's the one that she had that showed such a high percentage of survival. The cancer they get is in that high percent of survival, so it will not be life-threatening. How do we decrease our risk? Regular exercise and maintaining a healthy weight. Regular exercise. And again, I cannot overemphasize this. I cannot over-exaggerate it. I cannot over whatever, because these two things are not just important for breast cancer, they're important for our general health. When you talk about diabetes, heart disease, high blood pressure, everything that you can think of will benefit from regular exercise and maintaining a healthy weight. And we're so concerned about cancer, but if we do the things that would normally just make us healthier, would already put ourselves at decreased risk. Early pregnancy, not teenage pregnancy. I'm talking about pregnancy usually somewhere in your 20s. It's been shown to be beneficial. Patients who have had their menstrual period start early, 9, 10 years old, and they don't have children until they're in their 30s, that long period has been shown with a slight increase in risk. Even though it's a decreased risk factor, it's not entirely decreased risk because it's somewhat out of our control. It's not always in our control. Breastfeeding actually decreases the risk of breast cancer. So anyone who's pregnant, young, thinking of getting pregnant, that's another benefit of breastfeeding. Okay, fake news. Deodorants do not cause breast cancer, okay? They do not cause it. This has actually been studied extensively. I don't know who started the lie, but somebody did, and deodorants do not cause breast cancer. Mammograms do not cause breast cancer. I'm just emphasizing what Dr. Bryce said because she's absolutely 100% correct. It's a very low dose. It does not cause breast cancer. Large breasts increase cancer risk. No, it doesn't. It doesn't matter whether you're a AA or triple G. That is not the reason why you have breast cancer. Vegetarians cannot get breast cancer. That's not true. The one cancer, well, not the one, but the one that has been studied the most in terms of vegetarian and cancer has been colon cancer. And even so, that risk is not zero. It's just way less than the regular population. If you're a vegetarian, your risk of colon cancer is very, very low. It's not zero, but it's very, very low. Okay, there are other myths, but I just brought these here. And if you have a question about them, we'll talk about them. Now, she did such an excellent, Dr. Bryce did such an excellent thing on mammograms. I'm just going to say a couple of things. Early detection, early biopsy, early treatment, excellent outcome. This is a more detailed stage. Stage 0 is when you can barely find it in the breast. Luckily, we have people like Dr. Bryce who are just experts at finding it early. And these people, 100% survival. Stage 1, very small lesions, less than a centimeter, 92% survival. Stage 2, that is over a centimeter, just not quite an inch yet, still 85% survival. Stage 3 is when it leaves the breast and starts going into the lymph nodes. Still 74% survival. Stage 4, it drops off to 35% or less, depending on your treatment and how aggressive the tumor is. So you see, it's very important. The mammograms are very important. We use mammogram. Ultrasound really is not a screening tool because there are a lot of factors that have to be in place in order for ultrasound to be effective. And I'll just say that in case you have questions, Dr. Bryce is still with us, she'll answer that. Biopsy, we need to know what you have. It's not okay to just, even though the radiologists are excellent, there's some cancers that will look like benign disease. So it's important that we get a piece of tissue that we can examine. Right now, when I get a pathology report, when I was in school, when I was studying, pathology report had just a few basic things. How it had the grade of the tumor, how many abnormal cells there were. It had, and whether or not, when we did surgery, whether or not it spread to the lymph nodes. That was it. Then a few years later, we started measuring the hormone levels of the tumor. And that gave us more information. Now, when I get a pathology report, it's like 3 pages because there's so much additional information that has helped us narrow down our treatment so that we don't cause any undue harm, because the treatment can cause some issues, but we're just able to do so much more with less. So these biopsies that she talked about, they're excellent. And no, they do not spread cancer. MRIs and PET scans are some additional modalities that we use. They're more advanced, and these have to do with patients who are more high risk, patients with special types of cancer that are more aggressive, but they're not for routine screening. Now, these two types of breast cancer, I'm just mentioning them because they are often mistaken for something else. Inflammatory cancer actually looks like an infection. Whether or not you're dark or light skin, your skin has that red look like you have an infection. Pot orange, your skin looks like, you know how the skin of an orange looks with the little dimples in it? That's what the skin looks like. It's usually hard. It can even have draining sores. This is always presented as stage 3 or 4. This is why when we go back to that other slide, you see why they have such a poor prognosis. And then there's another one called anaplastic, which is not inflammatory, but it grows very fast. It's very aggressive and no pain. Patient, I can't tell you how much time people say, well, it didn't hurt. Well, that's the problem with cancer. Most of the times when it causes pain, you're way ahead of where you'd hope to be. And this one usually presents at least as a stage 3. Again, you can see why these two cancers are so deadly because they present so late and there's very little to do. Sometimes you have had a normal mammogram and within a few months, you notice that you're feeling a lump. Yeah, these cancers are just aggressive and that's it. It is what it is. When you see that, you just still have to be very aggressive in your treatment. So how do we diagnose breast cancer? The mammogram is our hallmark. 85 to 95% can be diagnosed with findings on mammogram. You know this is not 100. No, it's not. It's a man-made thing. It's never going to be 100. So someone is always there, well, I know someone who had mammograms and they had, yes, we know. But that doesn't mean that the 85 to 95% who are benefiting should stop getting a mammogram because of the 1 or 2 that unfortunately will not be diagnosed on mammogram. Ultrasound is used to define the masses and a really good tool for biopsy. MRI is used in high-risk patients, patients with abnormal mammogram and ultrasound, and the biopsy, that's what gives us a definitive diagnosis that this is cancer. Treatment. Most patients will need, well, at this point in time, actually, all patients will need some type of surgery. How much surgery you need depends on the stage. It could be just a simple lumpectomy, meaning removing the lump, or it could be lumpectomy with radiation. Sometimes lumpectomy, radiation, and hormonal, or chemotherapy, or surgery and chemo, surgery. There's all kind of combinations, but surgery, everyone needs to have that tumor out. That they have studied it, they have done patients where they've given them chemotherapy first and it shrunk the tumor, and they have tried to see, well, maybe we can just radiate. This is stuff that has been studied for years. No, if you don't take out that primary tumor, that patient will develop cancer again down the road. So surgery is part of it. It's not always first anymore. It used to be always first, but it's not always first anymore. But then a combination of the other therapies help us eradicate it from your body completely. Fictional treatment. Herbal medicine cannot cure cancer, okay? Herbal medicine is medicine. You just, instead of getting it from Pfizer or Lilly or Merck, you're getting it from the natural plants, but that's all it is, medicine. The only herbal medicine that's been effective in treating breast cancer is Taxol, which came from the bark of the redwood trees in California. Now they extract the active ingredient and use it as a very effective chemotherapeutic agent. But whatever herb, soursop leaf, whatever you're boiling, it's not going to cure cancer. There's no such thing as alternative medicine. There is medicine, there's treatment that is proven to work, and there's people who are giving you false hope and taking your money. You notice there's no strike through in dietary changes. Why? Because as my slide said earlier, it's never too late to change your diet. Even if you have cancer and you start some simple changes to eat healthier, to live healthier, it will help you go through your treatment and it will help your general health overall. So what do I need to do? Low-fat diet, routine exercise, adequate sleep. This is one of the ones that we forget all the time. You must get enough sleep. You do your monthly breast exams and you follow a pattern. Choose the same time each month. Yearly mammograms. Now, it used to be age 40. I still have age 40 on here. There's a lot of literature where they're saying between age 40 and 49. They're not sure that it's as beneficial as it would be. But I'm leaving age 40 up. We know that by age 45, you definitely should start getting mammograms. As you get older, as you pass your 70s or get into your late 70s, they recommend that you once again go back to the every 2 years. I've had patients as old as 95 with breast cancer, and I've treated them and they didn't die from breast cancer. They died from what most 95-year-olds die from. She fell and broke her hip. That's what killed her. That's the number one cause of death in patients who live to be that long. Patients who get cancer that late in life, those cancers most of the times are not as aggressive as the younger patients. So their treatment is, we limit the treatment. You know, this what we do for somebody in their 40s or 50s is not what we're going to do. Basically, we remove the tumor and we do some adjuvant therapy, but we minimize it. Yearly checkups, yearly pap smear. Dr. Bryce mentioned pap smears. Pap smears is a life-saving thing when it comes to cervical cancer. So there is some changes that have been made. The last time I did this presentation, I was blessed to have Dr. Perot, who is a OBGYN online, and she was able to help us out with some of the questions about pap smear. But these things just help us stay on top of our health and live healthier lives. What do you do if you found a lump? Do make an appointment to see a doctor. Do get a mammogram or ultrasound. I know it may not be as easy in some places as others. You may need a biopsy. If you're concerned, get a second opinion. If you're getting a second opinion, please don't do like the people in Jeremiah when they said to Jeremiah, pray and whatever the Lord said we'll do. And he prayed and he said, the Lord said, stay right here. And he said, no, you're lying. We're going to Egypt. Okay. So don't get a second opinion thinking you're going to twist some doctor's arm to say something that's not there. If you're truly concerned about what the doctor said, then get an open second opinion that you intend to follow. Don't panic and don't worry. Okay. Don't think that it's going to magically go away. And I use the word magically because we shouldn't be thinking about magic. But when it comes to breast cancer, I can't tell you how many people think it's going to magically go away. They watch this mass grow and grow, and they're still, oh, I'm taking this, I'm doing that, and it's not going away. And they're praying and it's not going away because God has provided an answer already that you have rejected. And so now you come to magical thinking, you know, when I wish upon a star. I'm in Florida, I'm right next to Disney World. So that's what they're doing. Disney, when I wish upon a star, it will not magically go away. Don't start taking some herb and that somebody told you about. Do not go on the internet to find information, okay? Don't do that because there's a plethora of foolishness on the internet, and that's all you're going to do is confuse yourself, or you're going to find something that make you feel good, and then later on you're going to die, because that's exactly what's going to happen. Facts. Early diagnosis equal great prognosis. The survival rate for breast cancer is so good. And when it's treated early, it is excellent. We're talking about almost 100% survival. Even with late stage, when we put all the cancers together, we're still talking about 87%, only 11% overall are going to die. So early diagnosis can mean also less aggressive treatment. You know, people are like, well, I don't want to lose my breast. Well, come in early, get your mammogram, like Dr. Bryce said, get it. And you don't have to lose your breast. We can treat you and you can live with your breast. I have patients going on 20 more years. I have friends who were treated, living right now with stage 4 breast cancer, and 20 years living. And when I say living, she's not curled up in a corner somewhere. She is living a life that many of us would like to have to live right now. Millions of women have been diagnosed, treated, and are living. It is something that they're always aware of, but it's not occupying their lives. Now, once you have a diagnosis, or if you have someone in your family who has a diagnosis, these websites are safe websites, because the information they give you is accurate, non-biased. They're not trying to sell you anything, and they're not selling you false hope and trying to take your money and getting you to not do what you need to do to save your life so that you can buy their product and die. But that's what happens. Cancer.gov. And even though you're in Jamaica, you have access to all of these. Thank God for the internet. Look at how it's helped us through COVID. Cancer.gov, breastcancer.org. This is run by the American Society of Breast Surgeons, of which I am a member. Coleman, Ms. Susan Coleman, many years ago was diagnosed with breast cancer. She started an organization. They help women get mammograms. They get women pay for treatment. There is cancer.org, which is the American Cancer Society. Cancer.gov is the National Institute of Health. It deals with all kinds of cancers. You can research any cancer there. Cancer.org also deals with all kinds of cancers, and you can do it there as well. And this is the American Cancer Society. This last one is called Sisters Networking. This is a group of Black women who got together. Dr. Bryce gave us some very important information about aggressive tumors in Blacks. And we believe that some of the statistics she presented is because of where we came from in Africa, because it's a genetic cancer. But this network is a network of Black women who they will match you with someone who is a similar age. I mean, there are a lot of little things that we as physicians and providers don't think about, like, like your intimate life with your husband, and some of the things that you may have to do because some of the treatments may cause dryness, etc. There's so many things. So having a sisters net, that's why it's called Sisters Network. It's a sisterhood of breast cancer patients. And you don't have to know anybody there. You can just go on and say, hey, I was diagnosed with breast cancer. I need somebody to talk to you. Send them an email, they'll email back to you. And this is someone who has had and has been treated. This is not someone who's trying to sell you something, and they're there to help. They really are. 87% are going to live. It is not a death sentence. There's no need to fear. It's not a death sentence. And here's the deal, because I'm talking to a church of which I'm a member of, this worldwide church. God is in control. We're not in control. So things will happen to us. This is a world where sin and suffering is going to continue on this side of eternity. So we need to pray. And again, I'm saying, not like the people in Jeremiah who say, all the Lord says we will do. And then when he says, the Lord said, you must stay here and serve Nebuchadnezzar, they say, oh, you're lying, we're going to Egypt. That's not the prayer we need. We need a true prayer seeking God's guidance, and he will guide you. There is no question. I have no question about that he will guide you. Claim the promises. He has so many promises for us when we're facing any situation. James says, if any is among you sick, you must pray. He will give you guidance. There's a way that seems right that is lead to destruction, but it also says if you dedicate your life to him, he will show you the path. Do the right thing. Do the right thing for yourself and your family. Remember, when you have this disease, if you decide that you're going to die with it or whatever, you're not just affecting yourself. You have loved ones. Some people have children that are growing up without a mother just because they were too afraid or too enthralled in this to do the right thing for themselves. And just remember that God is in control. So these are my last words, and then I'm done. I'll be here to answer questions. Trust in the Lord with all your heart and lean not on your own understanding. In all your ways acknowledge him, and he will direct your path. But you have to trust him and not what your cousin, sister, auntie said down the road, okay? No, for I know the plans I have for you, plans for your welfare and not for evil, to give you future and a hope. If God allows this thing to come to you, he already has a plan for you to deal with it. You have to know that God has a plan. Peace. You will keep him in perfect peace whose mind is stayed on you because he trusts in you. It comes back to trust again. Have that peace. It will allow you to do the right thing for yourself by the grace of God. thank you so much for your time, and I'm here to answer any question. I'll do my best. And Dr. Bryce is back with us too. So we're both here. She never left. She just took her camera off. The church is muted. She's speaking, but the church is muted. It's on mute. Someone please unmute the speaker at the church so we can hear her.
Can you?
Yes, we can hear you now.
Want to ask your question, you can use the raise hand feature and your questions will be answered. No question for Dr. Bryce and Dr. Sinclair? In Jamaica, they said.
It says Carol
Okay,
Bent
Carol
raised her
White,
hand.
there's one
I have one.
question. Dr. Sinclair?
Good afternoon, ladies. Very good
afternoon.
presentation. I have a family member who has been tested positive for breast cancer, but when she did the BRCA test, it was negative. Do you think I should do that test too?
Probably not. BRCA is a gene. It was discovered some years back, and the thing about it is, if it's in your, if you have a history and several people have first-degree relatives or multiple second-degree relatives, and they're tested positive for it, then yes, the others should get tested. But you just don't get tested just because there's a history in their family. Because most people with family history do not have BRCA gene. BRCA gene only comprises like 1 to 2% of all the breast cancer patients. It's more common in people from Jewish heritage, and it's way less common in minorities. There are other genes that we do test for, even though I do have folk who are us Jamaican folk actually who are positive for BRCA. And so it can happen. Now, of course, we're out of many one people. So we have a lot of mixed heritage when it comes to Caucasians, Chinese, Indians, you know, we're a mixed bag. But you don't test just because there's a family member, especially if the family member is negative, that your testing is probably going to not yield anything because it's a genetic disease. So if it's not there, it can't be in you either.
Okay. But I have heterogeneously dense breasts. And every year, for many years, I've been doing mammograms and ultrasound, but it is with the regular mammogram machine. And my sister was tested, it was detected using a 3D mammogram. So that's my concern, you know.
Yeah,
But
so
for my next mammogram, I should use a 3D.
So 3D mammograms or tomosynthesis, it picks up, let's say a regular mammogram, it picks up 4 to 5 cancers out of 1,000, and a tomosynthesis picks up 1 more out of 1,000. So it does have a slight advantage of picking up cancers. The benefit more of a tomosynthesis or a 3D mammogram is that it reduces the callback rate. I don't know if a lot of women have experienced where they have a mammogram and they send them a letter or they get told that they have to come back to get extra pictures, they have to get an ultrasound, and that's called a callback. And so patients who get a 3D mammogram have less of a chance getting a call back. And that's the real benefit. But otherwise, a 3D mammogram hasn't added a whole lot, but it does potentially pick up one extra cancer. So so if you have heterogeneously dense breast and you have a family history of breast cancer, I think the better test is to add an ultrasound if your doctor thinks you're eligible. Adding an ultrasound is something that is a decision that is made patient by patient. But if you have a family history of breast cancer and you have dense breasts, ultrasound picks up about 3 additional breast cancers. Almost 3D mammogram, 1 additional,
Okay.
ultrasound is 3. So ultrasound is probably a better thing to add than just the 3D mammogram. Although a lot of centers are just doing 3D mammograms automatically now. Maybe you just need to find one of those.
Okay, thank you.
Are you in the US, Carol, or are you in Jamaica?
I'm in Jamaica.
Okay,
So maybe
we don't know
Jamaica
this.
Jamaica not as 3D, but I'm trying to say though that the 3D mammogram doesn't pick up a whole lot more breast cancers, and I know ultrasound is in Jamaica.
And the ultrasound is additive. It's not a substitute. It's additive to the mammogram.
Right.
No,
and
I've been doing both routinely every year.
Then you're fine. The need for a 3D mammogram the 3D mammogram isn't adding more for you. You're doing your mammogram, you're doing the ultrasound.
Thank you so much.
Yep.
Okay, thanks.
And again, just to emphasize, an ultrasound does not replace a mammogram. As Dr. Sinclair said, I said it in my presentation, a lot of women, I know the mammogram is uncomfortable. It's uncomfortable for a reason. The uncomfortableness of a mammogram is the way that you're able to get the radiation dose really low. When you squeeze the breast, instead of it being this big, it's now this big. And the radiation dose therefore can be really, really low, and it holds the breast still. So again, the radiation could be really low, and it picks up the earliest form of breast cancer that ultrasound will not pick up.
Okay, thank you, ladies.
Okay. Any more persons, any more questions? All right. Any question? We have an audience here. Any question from the audience? Just give me your question and I'll forward it to Dr. Bryce and Dr. Sinclair.
Angie?
Extracting teeth. Relaxing.
Okay, there's a question from the audience.
Mhm.
Good afternoon.
Good afternoon.
I would like to ask, what are the signs or symptoms of breast cancer? Or symptoms that let you know or aware or that you have a cancer?
You hear that, sisters?
Yes.
She's asking,
Yes, we heard.
what are the signs and symptoms of breast cancer?
Okay, do you want to answer?
Yeah, I'll take this one. When you see signs and symptoms of breast cancer, you have advanced cancer. So we hope that you're not waiting to see signs and symptoms of breast cancer. And that's true, not just for breast, for any cancer. Most cancers, once you start seeing signs and symptoms, you have an advanced cancer. That's why we do screening. because we want to catch the cancers before they develop any symptoms. Cancer in general does not hurt. So you will not have like a painful lump. There are a few things that you may see that may be indicators. One is drainage, bloody drainage from your nipple. Sometimes that's an indication that you have what's called a papilloma. That is many of those are benign, but a few of those, once we do the biopsy, it will come back as a very early cancer. The other signs and symptoms that you have breast cancer is usually a lump. It's usually painless, and it's usually not something that's smooth. When you do your breast exam, it's usually not something that's smooth or easily moved. It's usually something that kind of is like in place. But I cannot overemphasize enough that you cannot wait. You should not wait to have any signs and symptoms. That's why we have Dr. Bryce and others like her, because that mammogram is going to find that cancer way before you can feel it. And that's going to make a difference in who lives with very little treatment and who have a much more aggressive treatment in order to have the same survival.
Okay. I know of someone who has been having drainage from the breast for quite a time now. And all the mammogram that she have done and the test, it doesn't show any sign that it's cancerous.
Can I just ask, what test has she had? Has she had a
what do you think could?
Try again, Dr. Bryce.
I think there's an echo. My question is to the person who spoke. Happy Sabbath. Can you tell me what kind of study she has had and how long the drainage and what color the drainage is?
It's a bloody look, you know, and she keep, because I work in the facility, and she keep coming for dressings from time to time. Sometimes you have a good amount, and another time it is very minimal. She have done the ultrasound, she have done biopsy, and they say it's not cancerous.
Okay, so in the US, and again, where there's more resources available to more people, we do the mammogram and ultrasound, and then we move on to an MRI in these patients. I know that there is the ability to do a doctogram where you kind of slip a little metallic structure inside the nipple and inject contrast to try to identify if there's a mass in that area. That is one study that could be done to see. Otherwise, the patient goes from me to Dr. Sinclair. And Dr. Sinclair, you would usually operate, or what would you do?
Well, the fact that she's having bloody drainage doesn't mean that she has cancer. One of the other things that can cause bloody drainage is a chronic infection in the breast. It's called mastitis. It is more common after pregnancy, but can last for months. And sometimes patients have multiple treatments with antibiotics. Patients who smoke also have a higher risk of mastitis, and there's also a genetic inheritance, meaning that their patients, I have patients where their mother, their grandmother all suffer from mastitis, and this can cause a bloody drainage, redness in the breast. If she has had it for a very long time, it is unlikely to be cancer. And the reason I say that is that cancer grows, okay? It doesn't just hang around. So if she has been suffering with this for months and months or even years, then she probably does not have breast cancer. She probably has a chronic infection causing this drainage from her breast. If she has had mammogram and ultrasound, and one of the things that could be done is to do a biopsy. I'm not sure. I know that they do have percutaneous biopsy because the last trip I went on was a trip with Yvonne, and I actually did biopsies down there myself, but I know that there are radiologists down there who do biopsies, and there's some surgeons down there who do biopsies. So if there's a question, that would be my next step, to do some sort of biopsy and get some tissue. But if it's been there for months and months and it's just a drainage, the chances of it being cancer are lower, unless, of course, there are other signs and symptoms we don't know about. And that's part of the thing. This is a general thing. So without having a chance to see her, it's hard to say everything. But if we really suspect cancer, the next step would be to get a sample of tissue to make sure it's not cancer. And if it's a chronic infection, there's a lot of things that has to be done to try to treat it. There are a few questions in the chat. One says, what are some of preventive measures? We did go over that in one of our slides. Maintaining a healthy weight, low-fast diet, regular exercise. Breastfeeding has been shown to help, but those are just some basic healthy things, and they may seem like they are basic healthy things, but they actually, when they study thousands of women, they find that women who do these things are less likely to have breast cancer than others. And then a question for Dr. Sinclair: what do you recommend for naturally painful fibrocystic breast disease, if there's any? Let me tell you, this is actually from a friend of mine who's online. Fibrocystic breast is the bane of my existence. It is not cancer. It doesn't cause cancer. And the reason I say that is because when someone comes to cancer, I know exactly what to tell them, and it's going to help them if they listen to me. With fibrocystic changes, it is just a lifelong condition. Like I said, it doesn't cause breast cancer, it doesn't increase your risk of breast cancer, but it can be quite annoying and just not a great thing to have to live with. What we're talking about is some people just literally have these little pockets, like little puddles of fluid in their breast, little cysts. It used to be called fibrocystic disease. Now we call it cystic mastopathy, meaning it's just their breast. There's nothing that they have done to cause it, just like how, all of us here are different shades of brown or lighter brown or whatever. That's just it. It's like you get freckles or moles. Some people have fibrocystic breast and some people don't. The things that worsen your symptoms are any sort of caffeine use. That includes chocolate, coffee, tea, and chocolate. So a lot of the sodas that have caffeinated products, those things will increase the pain and tenderness in the breast. We recommend that you make sure you're wearing the correct size bra, because good breast support helps. If the cysts are enlarged, usually in my practice, they come in and I literally will numb them up, pull off fluid, numb them up, pull off fluid, and they feel much better. And this lasts for several months. The good news is most patients, as we get older, the symptoms are less. Even though I do have my outlier patient, she's in her 80s, and I just drained her the other day, and I've been taking care of her since I came to Florida, which is almost 18 years. Her cysts just will not stop. Most patients, once they stop having hormonal, once they stop secreting hormones, once they hit menopause, the cysts and the symptoms do go away. Non-steroidals, if you're really in significant pain, warm compresses, local things, but there's no real cure for it. It's one of the things that are there. And that's why I call it the bane. Ironically, if someone has cancer, I can treat them and know they'll get better. With fibrocystic changes, is more of trial and error in terms of what makes them more comfortable. That's it for the chat messages. So we can go back to the church for other questions.
Okay, there's a important,
Okay.
there's one question in the chat. I did a biopsy and I was told I have cancer, but I don't know the stage. And I was told that to take my breast off. Okay, there's a little bit of a typo here, but it is small. It would be better to take it off. Do you think I should?
Breast small or is it cancer small?
This is there's a little typo here. If somebody could clarify, if not, maybe you could just talk about Dr. Sinclair.
Okay, so you have
when you need a lumpectomy, when you need a mastectomy.
What if you have had a biopsy? That means you have been examined, you have had a mammogram or ultrasound. We should be able to tell you what stage you are. We should be able to tell you what stage you are, because staging also helps in the decision making in regards to whether or not you just have a lumpectomy with radiation, or entire breast removal. Those decisions are made based upon what we see on the pathology report. So on this forum, it's going to be very difficult for me or anyone actually to give you specific advice. But if you have had a biopsy, then you should ask for a copy of your report, and you should ask the doctors about what is your stage and why are they recommending one treatment versus another. As I said, everybody's going to need some surgery, and that's how you do it. And of course, I don't have your history. I don't know. You said you did a biopsy. I don't know if you could feel a large lump in your breast, or if they found something on mammogram. So all of those things make a difference. So I'm not able to tell you what I think you should do, but what I know that you should do, you should review the pathology report with your doctor, as well as your doctor will review all your clinical findings, all those questions that I'm asking. I'm not sure. Now they follow up and said, yeah.
I think that's a new one.
Those are the things that you're going to have to do. You're going to have to review it with your doctor and find out in terms of your stage, and then look at the recommendations in terms of surgery versus mastectomy, why they recommend which one versus the other. Because all those things, they're not just arbitrary recommendations. We make them based on the size of the tumor, the stage, the aggressiveness of the tumor. Those are all the things that go into recommendations we make for whether or not we do a lumpectomy versus do a complete mastectomy.
And if the radiation is available, if a radiation isn't available, you might be more likely to do a mastectomy than a lumpectomy. Is that true? Okay,
yes,
so there's,
and I know that radiation is available in Jamaica. I mean, I have friends and acquaintances there, so radiation is available, and all the things are important too. And again, with radiation, one of the things that you must remember is that you have to have the ability to follow up. Radiation is intense. It's like 5 days a week, usually for a minimum of 4 weeks. So you have to look at your entire situation and say, am I going to be able to complete my treatment? Because one of the biggest problems that unfortunately, it's only in a handful of patients, is patients who are partially treated, who think that, okay, I've done one thing, I'm okay now, I'm not going to finish treatment. All of those patients have come back with cancer, and then it's usually more aggressive. It's kind of like when you partially do something, and then it comes back even more aggressive than it was before. So we can't tell you what we think we should do, because this is not the forum for it. But those are some of the things that I would recommend that you do.
I think it's also important because I also, unfortunately, I've had very good friends that have had breast cancer and have died from breast cancer. It's important not to pick and choose what you want. Some patients want a certain kind of surgery. They want a certain kind of chemotherapy or no chemotherapy. They want a certain kind of radiation or no radiation. And that's when you start getting into trouble, when you try to tailor your treatment for yourself. Breast cancer is one of the most studied cancers that there are. And because of it, a lot of advances have been made with breast cancer. And so that's why we're seeing a lot of people living with breast cancer, even in a very advanced stage, and not dying of breast cancer. So, but if you go to your doctor who spent so much time training to give you the best care possible, and they have a plan for you, follow that plan. It's not made arbitrarily, it's made out of a lot of evidence.
Thank you for that, Dr. Bryce. I actually told a patient one time when they were like, well, I'm going to do this. I said to her, ma'am, you're not at Olive Garden. And for those of you who don't know what Olive Garden is a very popular restaurant here in the United States where people go for dinner. It's not very expensive, so people go in there all the time. I said, you're not at Olive Garden. I did not give you a menu.
Right.
Okay.
Right.
Because I am very straightforward with my patients because their lives are at stake.
Mm-hmm.
And you have to understand that when you come to see me or any other physician, we're not giving you a menu. We're not a server in a restaurant for you to pick and choose. When we make a recommendation, it's based, like Dr. Bryce says, on thousands of patients, because patients, once they get cancer, are going into these registries. We have thousands of patients, Black, white, Asian. My youngest patient was 24. My oldest patient is 95. So we can look at, I only have one 24-year-old and one 95-year-old. Well, guess what? Across the country and across the world, because the societies speak to each other, unlike other government agencies, there may be 300, 400, or 1,000 people who have taken care of a 95-year-old. So I don't have to depend on that one experience. I have that information that I can use to help the person who comes into my office. But it's not a menu. I'm so glad you mentioned that, Dr. Bryce. It is not, we're not handing you a menu for you to choose from. We're telling you like these combinations are what we know will help you based on what we have in front of us. This one is for you, Dr. Bryce. In the chat, it says, I'm over 50. My breast is small and dense. I did a mammogram some time ago. It was extremely painful. I haven't been back since because I'm fearful of the pain. What other method would you recommend?
Yes,
Take it away.
I hear this all the time, and especially when I give talks to Black women and Jamaicans, especially, they tell me it's so painful. If you can take something like Advil, Aleve, ibuprofen about 2 hours before the mammogram, it does take the edge off. Sometimes you can ask the technologist, can you just do just enough, just enough for me? My breasts are small and it's very, very painful. Unfortunately, the pain part is hard to deal with sometimes, but if you take just a painkiller, you get it over the counter, ibuprofen, Motrin, something like that, just about 2 hours right before, 1 to 2 hours before the mammogram, it should take the edge off.
Or Tylenol or Panadol that we have in Jamaica. And look, I'm not trying to be insensitive, because trust me, I remember once the radiologist called me back. She's like, you know, I just looked at your mammogram. I'm gonna need to come back in for a diagnostic. This is my colleague. And I'm telling you, I was seeing stars. But I stood there because I talk to my patients every day and I was not gonna be the outlier. This is once a year and it could save your life. So you need to really decide if you're going to allow a moment of this. How many things in your life that you have done have been uncomfortable? How many times have we bought a pair of shoes that we shouldn't have bought and wore them anyway? Okay? I'm just being frank. How many times have we done something like that? Okay? This is once a year. And we're talking about your life. You're talking about your family, children. Oh, somebody put in their labor pain. That never stopped anybody from having children. I only have one daughter, but I know people with plenty of children. This is a lifesaver. So we need to woman up. or in the US, they say man up. I'm telling you, we need to woman up and just think about it. We're talking about the matter is life. Okay? The matter is life.
But just try a painkiller
Yeah.
before. Hopefully,
No, I agree with all that you said,
I-
Dr. Bryce, but at the end of
I
the
know.
day, we have to, we're us. We are, you know, yes, some of us are blessed to have husbands. Many of us, we are the ones who are taking care of our families, okay? And our children and our parents. I'm talking about Black women. I'm talking about Jamaican women.
Yeah.
We are the ones who are taking care of our children and your cousin who from the country who needed some help, and your parents and your grandparents. So what happens if something happens to us? It's not a forever pain. You're not going to be in pain forever. So you're going to do what Dr. Bryce says, take some Panadol, Tylenol, ibuprofen, as we call it in Jamaica, and take it and move on. You have a whole nother year to rejoice before you have to go back again.
There was actually another question. Balancing the hormones should be key then. I'm not exactly sure what the question is about hormones. Not sure. Maybe we can have a little bit of a clarification on that question. There's a question
It
about
was not a question. It was something Sister Sinclair was talking about the breast. And so I was saying then balancing the hormones should help about the cystic, the cyst in the breast.
Actually, there's no evidence that your hormones have anything to do with the cysts.
Because you were saying that a person with that kind of condition, usually when their hormone change, it kind of helps with the pain. So that's why I was asked, kind of making that statement.
I see what you're asking. Well, that's an observational thing, Ms. Selma, that we notice that most patients, as they get older and as they get into menopause, that they have less problem with cysts, etc. It's an observational thing. There has been nothing to suggest, and again, this has, even though breast cancer is usually the focus of most of the studies, all the breast diseases have been studied, and it really, there's no evidence that there's any imbalance in your hormones. That's not the issue. It's I tell people it's like having moles or freckles. It is you and fibrocystic mastopathy is common in families. It is you, meaning not your fault, but it is you. You have, like, you know, I have dark brown eyes. That's what I have. It's not anything that is going to change. So there's no hormones that need to be balanced. We just notice that there's less pain once you hit menopause, but it's not, there's no hormonal treatment or balancing that's going to make the pain go away.
Yes.
the footprints SDA Church, you're muted.
Well, it doesn't show mute, but I'm not hearing them either.
I know that's true. I just noticed
Galaxy A12, there was a question. Still want to ask it? If not, there's a question from the audience.
Go ahead.
Is there any truth that when there are multiple lumps in the breast, there is no cancer? Is there any truth that when there are multiple lumps in both breasts, there is no cancer?
Okay, I'll take that one because that's a very advanced question. So we have different, yes. So the question is, if there's multiple lumps or cysts or masses in the breast, there's no breast cancer. So when we looked at a whole bunch of mammograms, some women have very similar appearing masses in both breasts, and they're not cancerous. But we always look at all the masses to make sure that one isn't different, one isn't growing more than the rest. So we do have different terms. We call it BI-RADS 2, meaning that when we're looking at the mammogram, everything looks benign. And in women who do have multiple masses in both breasts, it typically does mean that there is no cancer, but it doesn't mean 100% there is no cancer. And so what we do is we look at the masses and compare them side to side and make sure one isn't growing more than the rest. So it's a little bit of a complex question and an answer.
I'd like to also point out that there are other things in the breast that are not cancer. I used to add a slide that said, not everything that goes bump in the night is a ghost, because there are other things in the breast that are not cancer. There's a thing called fibroadenomas, which are benign tumors. They're actually more common in Black and Latino women. I've had girls as young as 13 and 14 with multiple bilateral breast lumps. I've had families come to me in a panic because they think that their 17, 19, even 20-year-old has breast cancer. It's not cancer. It's fibroadenomas. And these patients can have multiple, and it can be bilateral. And so these are usually younger patients. What we do for those is if they have the larger ones that are painful, and these are painful, unlike cancer, we will remove those. The ones that are smaller, we do not remove them because we would end up doing a lot of operations on a young person's breast, but we do monitor them. Those we actually do monitor with ultrasound until they get to be a certain age. The issue with people with cystic mastopathy or multiple benign lumps in their breast is that from a radiologic point of view, it makes it more difficult because then you have to be very careful, because I have had a scenario where people have had cysts their whole life or benign lumps. These are non-cancerous lumps their whole life. But as they get older, as we said, as the risk of cancer go up, and I've had people come from very reputable centers where they looked at it and they said, oh, this woman always has fibrocystic, whatever, and the cancer was there. Now, of course, this was years ago. Now that we have the better studies, like we now have the Thomason CD, digital CD, I haven't seen that, but when I first started in Florida about 20 years or almost 20 years ago, I saw that more than once. Because there's a lot going on in the breast, even like the dense breast, it is much higher risk for it to be missed as opposed to when you have a breast that's nice and clear. So when you see something there, something is there. You don't even have to be a doctor. You're like, what is that on that breast? Okay. So you can never assume, and they still have to monitor the patient, especially as they get older. And if there's any changes, then you may need to have a biopsy. You want to add anything, Dr. Bryce?
No, that's perfect. But just in answer to the question, there can be multiple things in both breasts. And that tends to mean that there's a benign process going on. But again, we have to be careful to make sure we're not missing the one cancer that may be growing that looks different.
Right. And I have a question in the chat. It says, how long under the arm, is it cancer?
A follow-up question here, Doc.
Okay, go ahead. And then we'll deal with the next question. Go ahead.
This person is 43, he's 44, with 3 lumps in one breast and 6 in the other. That's a follow-up question to the previous question.
Remember, we're in a forum. This person is not our patient. So even that additional information really doesn't help us. That patient needs to be evaluated by someone and make a who's going to review their radiographic studies, the studies that someone like Dr. Bryce, who's going to look at their x-rays, mammograms, ultrasounds, as well as physician who's going to look at everything together, including the patient, and to make a recommendation. On this forum, it's not something that we can truly give a specific advice to this person because it's not our patient. We haven't examined them.
Yeah.
And even
we haven't looked at the images.
This is not the forum. We don't have the images.
Yeah.
All we can give is general statements, which we already have.
Right. So important. So the answer is important to talk to the radiologist that read the study, gave recommendations, talk to your doctor to find out what they think after reviewing the tests they've done to find out what's the next steps.
In the chat, we have having a lump under the arm, is it cancer? Again, there's no way for us to answer that. I can tell you that in a handful of patients, their breast cancer actually presents in the armpit. And I have seen that. I have diagnoses where it didn't start in the breast, it actually started in the armpit, because the breast tissue, actually in our development inside the womb, the breast tissue actually starts down in our groin and it goes all the way up onto the underarm. So they're what we call rest cells that can cause cancer. Most lumps under the arm are not cancer. At least most of the things I see in my office are not cancer, but you can have cancer of the breast under the arm. So any lump that you have needs to be evaluated by a doctor.
Okay, there's another question from a male. And then after this, we'll close off in Jamaica. It's curfew time at 6 o'clock. So we'll have to close off in another wrap up and just close off. So we have a question from a male.
So Doc, because of the men, they don't have mens at a monthly cycle. So what is the best time for a man to do their test to show if they don't develop the breast cancer? And is it possible that you can get like a hit from something and after that develop a cancer, which is a breast cancer?
So, okay, if you don't mind. So so yes, men can get breast cancer. Very rare, 1% of breast cancers are found in male patients. You can pick a day out of the month you like. If fifth day out of the month works for you, choose that day to check. The most common masses in men are usually right behind their nipple, and they're usually very, very painful, and it's called gynecomastia, and that's usually the most common cause. But it is not a bad idea for men to do breast exams. I don't think there is much data on men breast exams, but if you feel compelled, just pick a day out of the month and do a breast exam.
So you actually asked two questions. One question, I'm going to deal with that first, and that can you get a hit in your chest and it becomes breast cancer? The answer to that is no. The men that I've taken care of with breast cancer often come in with that history. And what happens is the lump is there, but because they're not examining their breasts like women do, they may even pass it feeling when they're showering or taking a bath and they don't think anything of it. But something happens. Like this one gentleman in particular, he was playing softball with his grandson and the ball hit him in his chest. And then he noticed, it was black and it wouldn't go away. And his wife was like, no, he's like, no, no, after several months, it would not go away. Those traumatic events, like something hitting you in your chest, only call attention to the fact that something is there, but it does not cause the cancer. We don't screen men for breast cancer because less than 1% of all breast cancers are in men. But if you are taking your shower, if you're doing something and you feel something that doesn't feel like, especially if it's not the same on the other side, then you should get it checked out. And as Dr. Bryce said, most of the time it's just enlargement of the breast. There are multiple reasons for this. But yes, I have taken care of patients with breast cancer, men with breast cancer. So the safest thing is if you feel something that doesn't feel right, then you need to get it checked out. I didn't know you guys had a 6 o'clock curfew.
Okay, there's a question from Sister Dunkley. She wants to say something, and then we'll close off.
Hi, everyone. This is Yvonne. I am sorry I was not able to come on earlier. I am trying to beat the curfew because I was in Westmoreland. So I am on my way. I'm now at Iron Shore trying to be in Trelawney before the curfew. I just want to say a big shout out to Dr. Sinclair and Dr. Bryce. They're always there when I call them, and they're always there to do it. They're always on my trips. They're always helping with fundraising. They're always doing their part. And I just want to say thank you. Thank you. A lot of us, we come and we leave home and we go to America and we really don't look back, you know? So shout out again to you guys by giving and just sharing and concern about us down here. And to all the listeners, please go get a mammogram if you're over 40. Do what we need to do so that you don't have to end up with breast cancer or any form of cancer. And thanks so much. Jamaica is on the curfew, so we're heading home. Thanks, everyone. Love you guys. Bye-bye.
Bye-bye.
Okay, thank you. Thank you very much, Sister Dunklin, and thank you very much, Dr. Bryce and Dr. Sinclair. Indeed, it was a very informative program, and we look forward to having more of this type of program, even when it's not Breast Cancer Month. And we want to thank the media team from the Footprints Church who made sure that our program was live, and you can watch this program again on Ray Media Group. And we thank the persons for joining our Zoom platform. Let us pray. Father in heaven, we want to say thanks to you for your blessings. Thanks, dear Lord, for the grand privilege that we can come together, whether near or far, to discuss issues of health. And I pray at this time, Lord, that you'll continue to bless those, dear Lord, who are giving to the cause of breast cancer. Thanks again for Sister Dunkley. And Lord, we pray that you'll continue to lead on in her life so that she can touch lives. Bless us now, Jesus. In your name I pray. Amen.
Amen.
Very much.
Now I can give you all my attention, Althea. I am so sorry. I was trying, and they were trying to get me onto the first program. I told them that I don't know if I can get on. She didn't know how to work her phone. Period.
I know me not work the phone. The phone was work, but the phone not picking up anything.
We couldn't hear.
All right, thanks everyone. Thanks, Ray.
Thank you too. Such informative program.
Okay, let me go.
Okay, let's start now.
Yolanda.
Yes.
I heard you part of it too.
Oh, my mother.
Your
father.
Your parents, your daddy's here too.
I know I said my mother and my father.
Okay.
How you guys doing?
You look very pretty, Bryce.
You did well.
All right. Love you all.
Love you
All the
too.
best, everyone. All the best.